I will be giving my talk today on the Dachshund Data Science Working Group, but I would like to emphasize that although I am giving the talk, this has been an incredible effort by really our sort of lead, Dr. Hiroki Morizono, and Kenny McKinley, who was previously my resident at Columbia and now is my colleague here at Children's National. So this has absolutely been an amazing effort by all three of us that has been supported by the CTSA. So I just want to make sure that everyone is aware this is absolutely not my group, it is our group. So first of all, Patrick already did a quick summary. I just like to sort of tell people who I am. I did most of my post-medical training in New York, but I was very, very happy to come back to Washington, D.C. This is my home. I've been circling around children's for a very long time. And so I took my first job here at Children's National. And then, as Patrick mentioned, I was super lucky and very honored to be one of the KL2 awardees, and I sort of moved directly into a K23 through the NICHD right after. So let's talk about the objectives of this talk. So first of all, I'm going to use my normal excitement to hopefully encourage all of you that that big data analytics, and artificial intelligence are not only here to stay in medicine, but that we all need to participate in it. And spoiler, you probably already are. I also hopefully will inspire you to jump headfirst into data science and healthcare related research. And I will do a quick summary of my very strange and circuitous research career. And then we'll go into the meat of the talk, which is the purpose of the Dachshund Data Science Working Group. And we'll also do a quick overview of what is actually already accessible at Children's, so that you know what you have available. And hopefully the working group can help you to gain access to what is available. So as I mentioned, first we're going to talk about what is big data analytics, artificial intelligence, and why we need to pay attention and care in healthcare. So what is big data? What I will first say is that big data is truly in the eye of the beholder. So there's a very classic definition of big data, which uses it started with the 3 V's, then it went to the 4 V's, and we can find 5 and 6 V's if you really want to. And it was actually a term coined in 2001 by Doug Laney. And it's nice because it gave a somewhat operational definition to what big data is. So when we talk about big data, the most obvious is the volume of data. So it is big. Again, I want to key focus, though, that it is truly in the eye of the beholder and the field that you are in. The velocity of data. So what is the rate at which data can be transferred from the source to a usable format that end users can actually gain access to? The variety of data. I think we're all very used to alphanumeric data, but we can't forget that there is image data, text data, audio data. There are just so many forms of data that are out there that we just need to figure out how to wrangle and access and learn from. And then I actually think this is one of the most important definitions, part of the definition of big data, which is the veracity, which really refers to data quality. So if you've had even dipped your toe into big data, you know that that dirty data is essentially useless. You need the data to be complete, you need it to have good quality, and you need to trust that if you start to use it to learn from it, that the conclusions you're going to come to are accurate based on the quality and veracity of the data. My favorite definition of big data is actually Hiroki's definition of big data, and that is data that is a pain to work with. And I think most of us who work with big data would echo this. It is a pain, but it's also incredibly fun. And I won't go into this, but I do want to emphasize that I would suspect that most of you on this call are working with big data, whether you know it or not. We've all had the experience of trying to open up an Excel file with a megabyte of data, and you get that really fun banner saying your data has not loaded properly. So in that sense, I'm sure many of you have already worked with big data. A terabyte in R could be big data if it's not wrangled well. If you're in genomics, which Dr. Morizono is, a terabyte is not big data, but in biomedical data, that would be big data. So this is why I emphasize it is truly in the eye of the beholder. Now, what is big data analytics? This is actually a term that frankly has confused me potentially up until recently, although I feel like I am absolutely still learning. But I like to put it in the context of healthcare organizations. So we know that in healthcare, we have volumes of data coming at us all at once. We have monitor data and of course data that's in the electronic medical record. However, it's frequently not in a format that's amenable to analysis. So the creation of these big data warehouses is really where big data analytics comes in because it simplifies the amount of data wrangling needed. Often there are analytic tools that overlay it. A very good example of this is right here at Children's National. We have Healthy Intent, which is the data warehouse where much of the electronic medical record data goes into. And then we have this beautiful analytic tool over it called Healthy Analytics, which allows actually any of us, and I want to emphasize that, to have access to that data and pull it in a format that we can then analyze and use. Completeness of data is always variable, and big data analytics allows us to sort of assess that. The one limitation frequently in healthcare is that unstructured data is often unevenly captured, if at all. But the main point of the term big data analytics is really a way to use, store, and subsequently analyze the big data. Now, AI, artificial intelligence in healthcare. This is a very busy slide, but the whole point of it is to tell you that you are already using artificial intelligence in your daily life. If you're wearing an Apple Watch, you are using artificial intelligence. If you're talking with a chatbot on ZocDoc, you just use artificial intelligence. Of course, I think this is a very important point. We have to thank the geneticists here because they are the ones that sort of pushed artificial intelligence into the forefront in healthcare research because they needed to. If you think about a whole exome sequence, a single person cannot go through every gene locus. So artificial intelligence allowed us to learn from those whole exome sequencing and translate that information to the bedside and aid in patient care. Medical imaging is another field that has really benefited from artificial intelligence. We've all heard of computer softwares that can quickly analyze a radiograph and allow the doctor to focus on the part of the radiograph that potentially has problems. And of course, hospitals are using artificial intelligence in many, many aspects of care. So again, the whole point of this very busy graph is just to show you that you are already participating in artificial intelligence. Artificial intelligence is here to stay, and we either need to embrace it or you're going to be fighting with it. And here is where I want to give some really good examples of what the role of AI is in healthcare already or soon to be in healthcare. So firstly, early detection of ailments. I want to give a critical care example. So, we have our Philips monitors always running, and I can't tell you how many times nurses come to me and say, hey, the monitor is saying that the patient has long QT. That alert is going to cause a doctor to then get a formal EKG. And many, many of our patients have been diagnosed with frequently transient, albeit long QT syndrome, that we can then augment our patient care based on that. Now, it can also help improve decision-making. This is a part of AI that's very near and dear to my heart and our research group because we developed what's called the criticality index, which is a data-driven approach to determine which patients are at most risk for ICU care. These models are already out there in certain adult hospitals. They're already being implemented. And we actually hope that Children's National will be a leader in really implementing these machine learning driven algorithms as well. Of course, it can help in treatment. There have been remarkable large comparative effectiveness studies that are only possible by the use of big data from national registries, so that we can determine if the strategies that we're already using are actually effective. And if they're not, can we examine other strategies? Expanded access to medical services. The pandemic is a perfect example of this, where telehealth became an incredibly useful approach to take care of patients remotely when it was necessary and appropriate. I had a personal experience with this. I happened to give birth very early into lockdown in the pandemic, and I utilized telehealth. So again, this emphasizes that we are all participating in machine learning, artificial intelligence in our daily lives. Associated care. So artificial intelligence can help sort of with the group care that we provide in a hospital, down from the pharmacist to the nurse to the doctor and all the people in between. And I could very much see artificial intelligence helping with current tasks that are done by people. For example, bed allocation all the way to patient discharge. You know, right now we have incredible nurse managers that dutifully do these tasks, but can you imagine how we can utilize those people with these incredible brains if we have machines helping us to do that? We've already talked about wearables and even down to end of life care. So if you think about monitors and machines that can help patients to have that end of life experience at home rather than being in a facility or in a hospital. So really AI runs the gamut from early detection to disease management to the end of life, and it's here to stay. Now, I know that there's a lot of fear about artificial intelligence in the sense that people think that these machines are going to take over our physician jobs. And I think anyone that has any experience in artificial intelligence can tell you that the machines are as smart as the people that guide them. They will never, ever take our jobs. The hope is that they will help our jobs. And I love this quote by Stephen Lin. He's a professor at Stanford and the vice chief of technology innovation. And he stated, for artificial intelligence to add the most value and for patients and physicians to embrace it, it needs to support, not supplant, the patient-physician relationship. AI will be the most effective when it enhances physicians' ability to focus their full attention on the patient by shifting the physician's responsibilities away from transactional tasks toward personalized care that lies at the heart of the human healing. So this is going to be the end of the section where I'm trying to convince you that artificial intelligence and big data is important. And I want to talk a little, just a 5-minute foray into my research career. The whole point of this is to show you that anyone can do big data and artificial intelligence. So one thing I love to say is that I actually started my career at Children's. I volunteered at the Hospital for Sick Children when I was a high school student. I then did a bunch of wet bench research at the NIH and an undergrad at Penn. I moved into basic science. Then I moved into clinical research, doing obesity research, global health. And then it wasn't until residency where I found my content interest in delirium. We developed a delirium screening tool that used standard biostatistical approaches that now is being used here at Children's and actually worldwide. That was all thanks to my mentor, Hani Traub at Cornell. So it wasn't until actually I became an attending here at Children's National about halfway into my first year here that I jumped headfirst into big data. Very quickly thereafter, I was really lucky to get the KL2, and as I said, I went into the K23. So how did I make this jump from standard clinical research into big data and artificial intelligence research? The whole point, remember, of this timeline is to say that I wasn't even aware of big data research until I became an attending here at Children's National. So how did I have my path to data literacy? It started with YouTube and Jim Chamberlain. So Dr. Pollack had access to this incredible database called the Health Facts database, and we needed to access it, and we needed to use SQL to access it. So I watched a bunch of YouTube videos. Jim Chamberlain gave me a bunch of his queries, and we just practiced. We jumped head first. I stopped becoming nervous about it, and I just went with it. Then I took some focus courses on Tableau, data wrangling, SQL, and some introductory Python. At the guidance of one of my mentors, I also took some biostatistical courses through Harvard, because you will realize that artificial intelligence and machine learning is very grounded in statistics. I finally learned how to execute some rudimentary machine learning algorithms myself through an MIT very intense course. I attended tons of conferences, but the truth is my real path to data literacy was guided by my mentors. So my success thus far has, I say largely, but I frankly want to say entirely, the result of my excellent mentorship team. And I will tell you that, if you look at the pictures on this screen, they are all leaders in big data research, data scientists, and the intersection of medicine and artificial intelligence and big data. So I was very fortunate because Dr. Pollack had already created this group. I jumped in, and then I had all these people to guide me in what database to use, what is the next best thing I need to learn. But I was acutely aware that most people do not have direct access to all these leaders and experts. And I truly learned this when Dr. Kenny came to Children's, and I was able, myself and Jim Chamberlain were able to sort of connect him with these people. And then it was really just in talks in the hallways at Children's that I realized that so many other people were actually trying to do this sort of research, but they didn't know the first place to start. And that was really where the inspiration behind this Docs and Data Science group started. And actually, a nod to Dr. McKinley, he had already created a working group in the PEM department. And it was sort of my pushing, cajoling, and sometimes forcing to get this into a hospital-wide format so that we could all come together. And I really like this slide because it just shows you that I really went from the bench to the bedside to data science, and next is going to be bringing the data science back to the bedside. And again, remember, I didn't do any of this until I was an attending, and I've now been at Children's this summer. It'll be 6 years. So it hasn't been that long, and we've actually had a lot of great success. So let's talk about the Docs and Data Science Working Group, because that is why all of you are here. And we are very excited about it. The purpose of the Docs and Data Science Working Group is to carve out monthly dedicated time for research collaboration and information sharing. We also would like to incorporate discussions on novel and core concepts in data science. We'd like to streamline the pathways and access to these data repositories. I will be honest and tell you that even with access to all the leaders in research and data science here at Children's, the path to these data repositories was rarely linear and required a lot of talks with various people at Children's. And I was just lucky to have people like Hiroki who were able to guide me to the right people. But again, I know that not everyone has this kind of access. So we're hoping that this group will be a home where not only you understand what is available, but how to actually gain access to it. We also would like to facilitate self-accountability regarding educational and research goals. A lot of data science is not taking, of course, classes help and they're very necessary, but then actually practicing and implementing it, if you don't do that, you lose all your skills. And I've had that experience. I've had to relearn many things many times. So my hope is that this Docs and Data Science Working Group will be sort of a self-accountability and group accountability group where we can inspire each other. And also connecting aspiring and current data science researchers with pro-level office hours, which will actually be held bi-monthly. And I'll go into that more in a little bit. So in terms of the core concepts that we hope to cover in the Data Science Working Group, we really break it up into 4 overarching modules. First of all, data wrangling. If you can't wrangle your data and put it into a usable format, you really can't get anywhere. So we will, of course, cover that. Data visualization. For me, data visualization was sort of the necessary next step after I learned data wrangling, so I could understand what my data was. Of course, we'll cover core concepts in data science and also core concepts in machine learning. And a lot of this will be peer learning, but we'll also invite experts in the field to also help us with a lot of our educational goals. We'll definitely cover core data science languages and practice them together. My language du jour is Python. I really sort of took to it and I love it, but a lot of people love R. The data scientists that we work with closely in our research group, Dr. Trujillo Rivera, works with R, so we will have experts that can help you with that. SQL. I think a bunch of us here started our education in SQL, so we will absolutely cover that. And then of course there's SAS and SPSS, which the Bird department often uses, and we will definitely gain their help in hopefully learning about that. So this is what we hope to do with the Docs and Data Science group. And I next want to go into what are the actual current data resources here so that you know what we can hopefully help you gain access to. And then I will tell you that if you have someone, an example is Health Facts. You know, we were sort of the group that pioneered working with Health Facts at Children's National, and we've been able to help other working groups work with it. So that peer learning and peer mentorship will find a home in the Docs and Data Science working group. So what do we have here? Of course, we have the electronic health record. I think that's very obvious. There's also Healthy Intent, which I touched upon briefly. That is the data warehouse here at Children's National, where a lot of that electronic health record data is cleaned and put in a usable format for all of us to extract and use. There's also Trinetics. I'll go into what exactly that is. There's the AllUS database, the N3C, which is the National COVID Registry, which is a subset of real-world data. PedsNet, which Children's National is now a part of, which is an NIH repository for pediatric data. Dr. Morizono is the lead on that, and I'm really fortunate to be a part of sort of helping that process along. And Health Facts, which was, I feel very fond of it because that was the first big database that, that our working group used. It's now called Cerner Real World Data. I'll get into that in a little bit. We have access to various CMS databases. And of course, there are several health information exchange databases, just like CRISP, that Children's National and GW have access to. So let's talk about the electronic health record. I call this dirty data because it really is not in the most cleanest of formats. You do need to have extensive data wrangling to have access to it. The PHI is frequently unmasked, so it requires an IRB to gain access to, even when you have an honest broker. It uses Cerner command languages, which is similar to SQL, but it's slightly different. And frequently you have to work with a data analyst in order to gain access to the EMR data. Now, Healthy Intent is wonderful, and I would truly encourage everyone on this call to take the cornerstone course that is held by held by Theodore Carpenter. It is, I think he offers it at least on a monthly or quarterly basis, but truthfully, I have sent a bunch of the fellows that work with me to take the course, and if he can gain a critical mass, he often just will do a course. You do not need coding experience to access Healthy Intent. There's a wonderful overlay analytic layer called Healthy Analytics. It uses SQL, but it also uses business objects where you really don't need coding. It's a lot of drag and dropping. You do need to understand core concepts, but Teddy Carpenter has this course where honestly in 2 hours, you can kind of jump right in and learn. And also the My IT Workbench that's here at Children's National can also help you with your queries. It only has structured data, so there's no notes in Healthy Intent, so that is important to understand. But the wonderful thing is that the ETL and data cleansing has been done. So this data is in a really wonderful and usable format. And we actually used Healthy Analytics for one of our criticality index models to get data to actually train models. So I can't emphasize enough that this is available to everyone at Children's, and I highly encourage you to try to use it. GW also has its own form of a data warehouse called Cerner Discern Analytics. Of course, I don't have much experience with this. It's not de-identified, similar to Healthy Intent. You either can use an SQL dialect or work with business objects, which again, it's more of a drag and drop that doesn't require coding. But again, it's not really that effective for complex data mining, but it's good to get the data and then use external tools to subsequently analyze. Trinetics is actually a really powerful tool that I feel like not a lot of people have learned about at Children's. What this does is it actually extracts data from Healthy Intent sort of in in many hospitals, not all, that use the Healthy Intent data warehouse. The power of this is if you are thinking of a study to do but have no idea how many patients have a diagnosis, you can actually do a cohort and find out how many of your patients have, for example, a diagnosis of COVID-19. You can work with the CTSI-CN Bird Department to do these extracts, although I will tell you that I took a Trinetics course when it was first came here, and I had no coding experience at the time. And it's similar to business objects in that it's a drag and drop user interface that once you learn, it's fairly easy to use. And again, not only can you figure out how many patients have a diagnosis that you'd like to study, but you can actually float queries across the whole Trinetics network, so you can potentially find patients at other sites. The specific patient information is masked, but if you can gain an IRB, then many of the MRNs can actually be available to you after that. So it's quite a powerful tool that I think is not used quite yet enough. There's the AllUS research network, which has 500,000 participants in it. You can actually explore it even without registering it, but if you want patient-specific information, you just register. The website addresses are right there. And it's really easy to access in the sense that the researcher workbench has Jupyter notebooks with R and Python available to take a look at the data. Real world data, which I am personally most excited about, has 96 million patients and 1.4 billion encounters. Now, this is the successor to the HealthFacts database, which we used extensively previously. And it's very nice because it's in a format where you can have a similar Jupyter notebook overlay or Jupyter notebook-like overlay, and then you can access the data using sort of traditional languages like Python. The volume and sort of variety of data in real world data is truly unparalleled. It has, of course, diagnoses, medications, procedures, labs, vaccinations, questionnaires. It has access to outpatient data, inpatient data, and also emergency data. Currently at Children's, we have 3 access points to it. The data science leadership here at Children's is working on a way to streamline access to end users, and that is in the works. But it is a really wonderful resource that we have available at Children's. And again, we're hoping that the Docs and Data Science Working Group will help to streamline access to this data in the near future. I also think it's important to know that we already have a data science leadership here at Children's National and GW. And these are really, Children's was very forward thinking several years ago in splitting up the informatics leadership into 3 roles. And we in fact have a Chief Research Information Officer, Dr. Mihailo Kaplaveric, who's been incredibly supportive of this effort to create the Docs and Data Science Working Group. And he is a wonderful resource for people at Children's to help guide them. We also have a CMIO, Dr. Jessica Herstek, who is really more of the physician and EMR interaction sort of leader here. And of course, we have a CIO, Matt McVeigh. We also have the CTSA Bioinformatics Core led by Dr. Hiroki Marizono, who I've talked about quite a bit now, and also Dr. Ching Zhang Treatler as well at GW. Dr. Ching is also the head of biomedical informatics at GW, and we worked with them incredibly closely to partner to create a lot of our clinically relevant machine learning algorithms. So they're a wonderful resource as well. We also have the Innovation and Bear Institute. Hopefully when more of us are coming in person, we can have access to them, but they're a wonderful resource. I don't want to I really would like to emphasize to you guys that the help desk, My IT, is also an incredible resource for all the Cerner-based resources here, and that includes Healthy Intent and Healthy Analytics. I have used them frequently. And of course, we hope that Docs and Data Science is going to be a new home for everyone that would like to perform, execute, or even just learn about what is available and accessible at Children's National. So the Docs and Data Science Working Group will officially launch at 2 p.m. Thursday, April 21st. I'm going to rely on Patrick to send to all of you a Zoom link, which will be forthcoming soon after this talk. The first meeting will be virtual, but we will definitely likely transition to both hybrid and in-person models in the near future. The pro level coding office hours that Amy Hu will be running will be bi-monthly every Tuesday at 3 p.m. And our first session with her will be April 26th. And this is really a time where you can drop in and talk directly with the people to help you with your coding. So this was a really important part of the working group that we wanted to institute, so that those of us who are sort of fledgling data scientists have access to pro-level coders that can hopefully help us. And I also just want to lastly emphasize one more time that no experience in data science research, or coding is required to join the working group. Just an eagerness to learn and grow in a collaborative research environment. I promise you, hopefully you garnered from this talk, I am not scary. Dr. Morizono is not scary, and Dr. McKinley is not scary at all. We love to talk about these things, and we really hope to just be a resource and a home for you so that we can streamline your research and encourage you and cheer you along the way. And at this point, I would love to open up to any questions. I put my email there. Please do not hesitate to reach out at any time if you have any questions about the working group. And thank you guys all for joining me. It's such a gorgeous day. So I feel extra honored that you decided to spend some time with me today. Thank you.